Welcome back to the East Meets West podcast. I'm your host, Dr. David Cherian. I am a practicing Western medical physician in Houston, Texas, and I am also a licensed acupuncturist and practice at my clinic, Houston Acupuncture and Primary Care, also in Houston, Texas. And this is the podcast where we talk about different medical problems from both a Western and Eastern medical perspective. And because I have a background in both of those, I like to share insights that you may not see if you just know or approach a medical problem from one side alone. And so we do different topics on here. And actually, one of the topics that came up to me by one of my patients recently, and I did a short video on this as well, which is kind of what made me think about expanding it for today's podcast and going into more detail about it, is the topic of MCL injuries. And we're going to talk a little bit about just broad overview of musculoskeletal issues and sports injuries in Chinese medicine. And we'll look at some of the details of specifically MCL, because I think that's a unique case that can really benefit from Chinese medicine. And also just talk a little bit about how in Chinese medicine, we're not just trying to fix the current problem, but we're also taking steps to help prevent you from getting re-injured. Because one of the things that happens to patients who have any type of knee injury is not just that you want to get better from the current injury. A big part of it is also just trying to prevent it from happening in the future. That can be almost just as debilitating, the fear of re-injuring the knee or something else happening again. And we know that once you have an injury, you're prone to have additional injuries. And there's different reasons from a Western background, whether that be overcompensation or incomplete healing or different things that could cause those mechanics to happen. But from a Chinese medicine perspective, a big part of reasons why a person who has a sports medicine injury gets another sports medicine injury is because the underlying organ that is responsible for that type of muscle or tendon or ligament is weak, and other ones in the body may also be weak. And so treating the root problem, which is treating the underlying organ that was the root one that caused that first injury, is crucial to actually just strengthening your whole body, helping the one that got injured heal, and then preventing additional injuries. So it's a really different approach. And that's what I wanted to spend some time on during the second half of the show today. So why MCL specifically for today's talk? Well, probably because I've had a few cases of this in my clinic recently, and I thought it'd be interesting just to go on a deep dive on it. And then also MCL is one of the most common injuries, and I think it's the most common knee injury as well. So it's a good one just to do kind of a case analysis or a review on specifically. MCL injuries are very common in sports like soccer, basketball. There's a lot of lateral movement that may happen, wrestling, hockey, and it's common in all different levels: high school, college, professional levels, even just leisurely activity or leisurely sports. So it is a very common injury, and we see it a lot in our clinic. Let's talk a little bit about the anatomy of the knee. I'm not going to go into a lot of detail because honestly, it's probably a lot easier if you just Google what a picture looks like. It's worth 1,000 words. And so, but briefly, the knee is where your femur or your thigh bone connects to your tibia, which is the large bone that goes below your knee down to your ankle. And that attachment is really secured by a few different ligaments. You have your anterior cruciate ligament and your posterior cruciate ligament. Those are the ones that are more centrally. That's the ACL and the PCL. And then on the inside, you have a ligament which connects the femur bone to the tibia, and that's the MCL, the medial collateral ligament. And you have one on the outside as well, which is the lateral collateral ligament. And so all four of these ligaments are connecting to help stabilize the knee and connect the bone from the femur and the tibia together. And so, like I said, that MCL is the one on the inside. So if you get injured on your MCL, you are going to have pain on that inner knee. And knowing the anatomy, one of the common ways that people do injure their MCL is having a forceful bending inward of the knee that causes pressure and stress on that inside of the knee and that medial ligament. And so that can happen. A lot of times they did studies in soccer that showed a majority of the injuries to the MCL happen when soccer players were fouled by oncoming opponents who basically just barreled into the lateral side of their knee, the outside of their knee, and bended it inward. And that was the most common cause of knee injuries, at least for soccer players. So knowing the anatomy helps you kind of know what kind of stress is going to damage that MCL. If you injure the MCL, one of the things that your doctor may look for is if there is a swelling there, like a joint effusion. That's the technical word for a swelling. And if you just sprained the MCL, then you usually aren't going to have swelling there. If you do have swelling and it's a MCL injury, that might mean you had a tear. And so usually if there's no swelling, then it may just be a sprain. And sprains are when you strain the ligament, but it doesn't actually tear or specifically injure it. One of the tests your doctors may do to examine your knee just while you're in the office is they will put pressure on the knee and try to bend it a little bit inwards to see if that knee joint opens up at all. And this is important to help diagnose whether the MCL is injured, but it's also actually helpful to give a grading to the injury if you did injure the MCL. And MCL injuries are graded in 3 different categories. You have grade 1, grade 2, and grade 3. And it's a combination of how much of the joint opens up, and it's indicative of how much of the MCL may be injured or torn. So grade 1 is the least serious. It's the mildest injury. And you're looking for less than 5 millimeters of joint opening with that pressure test that they do. And in a grade 1 injury, you may have a few fibers that are torn in the MCL, but it's overall still intact. The medium grade is a grade 2 injury, and in that scenario, you're going to have 5 to 9 millimeters of joint opening. There's probably a incomplete MCL tear at this point if it's opening that much, and that's what a grade 2 is. The grade 3 MCL tears is 10 millimeters or more, and this is a complete tear. It does not, your knee joint can open without any clear end point. So that's the most severe type of grading for an MCL injury. When it comes to imaging tests, the main imaging test that is done is an MRI. And an MRI can help to distinguish other knee injuries, and it can also help to differentiate the extent of an MCL tear if there is one. It's not the only thing. So a big part of it is still the clinical exam, but MRI is also often used in conjunction with it. We'll talk a little bit about treatment from a Western medical standpoint, and then I'll spend the rest of the time talking about MCL and injuries from a Chinese medicine perspective. So the treatment for MCL is a lot of basic things. It's always recommended to give rest, pain control with over-the-counter medications like Tylenol. Tylenol is probably one of the best ones. And then just elevating the knee. And then ice is also helpful. You might want to do it in the first 2 or 3 days. using ice can be helpful. Sometimes people will do compression or elastic bandaging to help limit and protect the movement, or like a brace. You may need a crutches to help walk as well. So those are some of the early basic measures that you need to do. And a big part of it is just letting it rest and let some of that swelling and edema come down. One of the important things is you do want to have mobility in the ligament and in the knee as soon as possible. You don't want to just immobilize your joint. So you don't want to just put it in a cast or something that's going to immobilize it and prevent it from being able to do any movement, because that actually has been shown to have poorer healing and poorer outcomes. You don't want to immobilize the joint. So sometimes we do need to temporarily brace it just to help support the joint if it's unstable when you're walking, but we don't want to do any sort of prolonged immobilization for any type of MCL injury. The other big part of treatment from a Western medical standpoint is doing rehab. That's one of the biggest things, and it's probably the main thing that you need to do, because like I said, getting the joint mobile again and doing some sort of movement and mobility is in general the best for long-term benefit. They've done studies which showed that using a brace along with rehab was equivalently good as surgery for football players, and it actually helped them return to sports faster and with less problems. And so there's good evidence that doing rehab is the core aspect of treatment from a Western medical standpoint. Now, let's spend some time talking about MCL injuries from a Chinese medicine standpoint. So, first of all, if you look at the knee as a whole, the knee is a joint that's associated with the kidneys. The kidneys, oftentimes in the Chinese medical literature, control the lower back and especially the knees. And oftentimes, if you have a patient who has weakness or pain or some sort of joint problem in the lower back and in the knees, that oftentimes is attributable to the kidneys. Now, on top of that, you have the liver, which in Chinese medicine is associated and responsible for maintaining the ligaments and the tendons. And so the liver is the organ that is really in charge of the health of the attachments of the musculoskeletal system. And so the liver, along with the kidney, is especially related and come together in that MCL area. Now, interestingly, if you are familiar with acupuncture meridians, the meridian or the channel of both the kidney and the liver, they travel across that medial portion of your leg, and they both actually travel right across the medial portion of the knee. And that makes sense in a Chinese medicine perspective, because in Chinese medicine, we divide the entire body up into both yang and yin, or both a yang or more external, active side, or more yin, more internal, more substantive side. And so the inner part of your body tends to be more yin type. And so the inner part of your leg is where the yin channels run down. And the liver and kidney are two of the most important yin channels, and they run along the inside of your leg, and they both go right across that medial part of the knee. So that is itself indicative of how important that inner portion of your knee is and how closely related it is to both the liver and the kidney. Even in a Chinese medicine perspective, and looking at how the acupuncture channels run, that medial portion of your knee is very sensitive to weaknesses of the yin energy in the liver and in the kidneys. And for my patients who come in with MCL injuries, we will usually use a combination of different points along the liver and kidney channel. Some of them may be right there next to the MCL area, anatomically, but some of them may also be distal from that or different points along the liver and kidney channel. But that's one of the reasons why when you get acupuncture with us, we don't just stick a whole bunch of needles right next to your MCL. We're actually looking at which organs are associated with it, what is the organs that are causing it to be weak, and then we're choosing points along those channels to help strengthen the underlying problem. And usually when a patient comes in, all of the patients I've had with MCL injuries, we never just do the same points. Everyone's got a different body constitution. And so you might have a weakness in the liver and kidneys, but you may have something else going on, like a spleen problem as well, that's impacting your liver and kidneys from functioning optimally. So everyone's got a different combination of needs and relative strengths and weaknesses. And so what we're doing during the evaluation in a Chinese medicine perspective is looking at your whole body constitution and how all of it is running together, and then making a individualized treatment plan. And especially for MCL tears, it's going to usually have some involvement of liver and kidneys, but there is going to be other things along with that. When it comes to herbal treatments, again, going back to the root problem of liver and kidneys, there's a couple different herbs that are going to be used. There's some general ones, and then there's going to be more specific based on your condition. A few different herbs that can commonly be used to help with strengthening the liver and kidneys, and especially for musculoskeletal issues, are Duzong. That's a good one. Sangji Sheng is one that I commonly use. And then another herb that we use is Zhu Duan, and I'll spell some of these out in the show notes because it's hard to tell otherwise. Duzong and Zhu Duan is used together actually in conjunction, and both of those herbs are herbs that are tonifying the liver and the kidney, and they're really helping to strengthen those two organ systems. And they have a unique property of also helping the musculoskeletal system and also moving the blood, which is a big part of healing. I talked about this in one of the recent short videos that we did about, it was Zhu Duan, I think, actually. Zhu Duan is a herb that actually also, it literally means to reconnect what is broken. That's what the literal translation of it is. And it's called that because it's been used in Chinese medicine to reconnect broken musculoskeletal problems like tendon injuries or ligament tears. And the ancient Chinese physicians knew that this was an herb that can have those types of healing properties, and they knew that it was an herb that went to the liver, went to the kidneys, helped the tendons and the ligaments, helped strengthen the musculoskeletal system. And Zhu Duan is particularly unique because it also moves blood, which can help in an acute scenario as well. A lot of times after you have an initial injury, there's a lot of swelling there. You can have ecchymosis, bruising, and a lot of that is, in Chinese medicine, we call it blood stasis, where the blood and the qi is no longer flowing smoothly because it's been traumatically injured. And so when you have a lot of blood stasis and qi stasis, the healing is slow. You have a lot of pain there, and Zhu Duan is an herb that can actually also help to move the blood and help the blood flow improve and help nurture and nourish the organs, the tendons and the ligaments. And that's actually a big part of the last thing I wanted to talk about when it comes to musculoskeletal injuries. And this is a little bit more in general, although it definitely applies to MCL injuries, but it's useful for all kinds of other injuries. You know, if you play other sports like tennis or golf or volleyball or baseball, whatever, you might be predisposed to other injuries, like injuries in the elbow or shoulder, anywhere where you might have repetitive movement. And one of the common underlying threads in Chinese medicine is that the tendons and the ligaments are related to the liver and kidneys. So in Western medicine, we don't really have a good answer on how to prevent re-injuries. we do know that patients and athletes who get injuries are prone to having further injuries. How many times have we seen professional athletes who get an injury and then they do rehab, they come back and then it gets injured again, and maybe they go through that cycle again and it gets injured. And a lot of times professional athletes end up having to end their whole career because they can never fully get back to fitness and get back to the way that they were functioning before that injury happened. And the reason is because in Western medicine, although we're doing rehab and doing exercises and in some cases even surgery, the underlying problem, which is a problem of the liver and kidneys, is not really being addressed because there's no way to do that from a Western medicine perspective, which is, I think, one of the big limitations from a Western medicine perspective, and where I think Chinese medicine has a real edge, a real advantage, is that we can really treat the underlying problems. So if you're a professional athlete or even not necessarily professional, but just a frequent athlete who's out there utilizing a certain joint or movement repetitively, you're going to be placing a certain amount of stress on your liver and kidneys because, like I said, those are the organs that are supplying the tendons and ligaments and the joints, and that continuous repetitive movement can drain some of the energy over time. And so one of the most important things that we do in Chinese medicine from a sports medicine perspective is to really help to nurture and nourish the joints and the musculoskeletal system by strengthening the underlying organ system. And specifically in the case of the MCL, strengthening the liver, strengthening the kidneys, tonifying those so that they can actually help nourish and nurture the ligaments and the tendons and muscles that you're using on a regular basis in those sports, and help prevent you from having future injuries. Because in a Chinese medicine perspective, if your ligaments and your tendons and the joints are well nourished, they get enough blood, they have enough qi, the kidney provides enough warmth, then getting injuries shouldn't happen. Obviously, if you just do something severely traumatic to it, it'll damage it. But if you're otherwise playing sports in a normal manner, it shouldn't get injured. And that's kind of also one of the reasons why, when you look at athletes, we know that some people just get injured more than others. And it's not necessarily because they're, playing more recklessly. And people always have all kinds of speculation, like, why does this player tend to get injured more than another player? And some people might speculate, oh, they're not, training enough, or they're not doing enough exercises properly, or they tend to move in a certain way that predisposes them. All those kinds of speculation is unnecessary in a Chinese medicine perspective, because the reason in Chinese medicine that somebody will get injured more is just because they have a relative deficiency of certain organ systems compared to somebody else. Like if you have a relative deficiency of your liver yin energy, or your liver blood, or your kidney yang energy, you are going to be predisposed to certain types of injuries more than another person will. And so if an athlete gets recurrent injuries and they're doing everything that they're supposed to be doing, it's not anything else. The problem is they have a underlying organ deficiency that needs to be addressed. And that's one of the things that Chinese medicine can do. So we do have, I brought up this podcast today just because we had a few of these patients in the clinic over the past couple weeks, just a couple patients with different MCL injuries. And so I thought it'd be a good topic to cover here. But if you do have musculoskeletal injuries, even if it's not necessarily sports related, we would love to hear your story. Or if you are a athlete and you have been if you've been sidelined because of MCL injuries or other musculoskeletal injuries, and you want to try to do everything you can to get back onto the field or whatever sport you do and really limit your future risk of injury, I think Chinese medicine, acupuncture, and herbal medicine is something that can definitely help you. If you would like more information, check out our clinic at www.houstonacupuncture.com, and you can always call us to get more information. We love talking about medicine and health, and whatever specific condition or questions you might have, we'd be happy to talk it over with you and see if we can help you with your situation. So anyways, that's a little bit about MCL injuries and how we look at it in a Western medicine perspective, and then more interestingly, how we look at it from a Chinese medicine perspective and what Chinese medicine can offer to you. And we'll see you next time on the East Meets West podcast.